Ungu, please, round of applause. We have Professor Wilberforce Owusu-Ansah. We have Dave Fenton. We have Sobisa Makanda. And we have Marie-Therese Ndiaye. So I'm not sure if we know who the finalists are yet, do we? Okay, we'll try to make this a bit exciting. Okay, I'll announce them one at a time, but I'll need a drum roll. So first, idea stage winner. Dower points. Second idea stage finalists. Damwa boosts. Okay, quickly, was there any Moi influence in the? No. Oh, no? Okay. All right. I'm just checking. Okay. Third idea stage winner. Mosan Health. Fourth idea stage finalist, Herb Ima. Fifth idea stage finalist, thank you judges, CardioSense. And the final idea stage finalists, Menstrual Empowerment Initiative. Amazing. So for the finalists, you're each going to be pitching in that order, right? I just mentioned your name. So Dower Points, Damwa Boost, Musan Health, Herb Ima, CardioSense, and Menstrual Empowerment Initiative. I'm sure you all have your instructions, so please, let's make this as exciting as possible. For those who did not make the finals, you did amazing. The feedback from the judges were overwhelmingly positive, so please give yourselves a round of applause. All right. So I would like to invite to the stage the founder of Dower Point. Please, another round of applause for him.
Anyway, I just want to say welcome all. I hope you all have a great experience hearing about PowerPoint as we wait for the technical team to do their thing. Yeah, and I'm really happy to be here on the stage. I want to thank everyone for the support, especially the Moi University team and the Cube. Yeah. So we thought of this project, myself and my co-founder, a few months ago after we had traveled around the world a bit. And, you know, we saw so many challenges and we were like, why not do this for Africa? Thank you to the technical team. Okay, so good morning, everyone. I'm Alvin Kiprop, and I'm here to talk about PowerPoint. So Chebet is a mother of three from Baringo County in Kenya. She has been on blood pressure medication for the past 3 years. Her tablets are small, cheap, and effective. However, the problem is not the medication that she's taking. It's not that they're not effective. The problem is getting access to this medication. Last March, she traveled to the hospital. Unfortunately, the nurse told her that the medication that she typically takes was out of stock. She was told to come back in 2 weeks. Unfortunately, she couldn't afford to. She had to stretch her last remaining tablets for another 6 weeks, skipping entirely on some days and cutting them in half on others. One Tuesday morning, she collapsed in her kitchen floor and her 8-year-old daughter found her. So we were medical students when we kept meeting patients like Chebet, whose only challenge was getting their medication. We decided to build our point, a solution that would have placed an automated drug dispensing machine at a market center near Chebet. She would have been able to pick up her medication that morning and been back to prepare her child for school. So in Africa, especially in sub-Saharan Africa, the distance is often deadlier than the disease because our patients travel for an average of 2 to 4 hours, which eats up most of their monthly income, up to 20%, only to be told that they don't have medication in the pharmacy. So these gaps lead to a cycle of declining health and poverty with low adherence rates and preventable hospitalization, which drives up the cost to the health system. There are 40 million chronic disease patients. 1 in 4, that's 10 million of these patients, have to skip their doses because they cannot afford to get to the hospital. And studies show that there's a 36% stroke risk cut with consistent adherence. So Dower Point is an automated drug dispensing kiosk. Think of it as a health ATM, where you are able to walk up to it, place your hand on the biometric scanner, ensuring right medication for the right patient. It has a reinforced steel exterior for security purposes. It's solar powered for off-grid viability, enabling us to deploy them anywhere in Africa. A touch interface for video conference with a remote telepharmacist or a nurse, and then our patients get a 1 to 3 month supply of their drugs. We envision a secure, verified interaction that takes less than 3 minutes, rather than our patients traveling for hours. This solution is highly reliable. It's low cost because we want to undercut the pharmacies, the sub-wholesalers, who mark up the prices up to 20 times the global market. It's highly rural. We ensure high rural reach by placing them in community centers, and we ensure that we maintain clinical oversight by using a live telepharmacist. We employ a hub and spoke model where the partner pharmacists act as our legal hubs for restocking pharmacy and poisons board compliance, that's the regulatory issues. And also we leverage the existing supply chains, while our spokes, as I mentioned, will be placed at community centers. We ensure sustainability through B2B and B2G models, where we sign contracts with the regional and national governments, grant funding and donor programs. We charge a dispensing fee. That's $1 for every transaction and interaction our patients have with the machine. We have pharmaceutical company partnerships where we are able to sign preferential agreements with them, supply agreements, and also they can be able to do market research using our machines. And then later on in our later phases, once we penetrate the market, we can sell anonymous data insights. The team is myself, Alvin Kiprop, and Whitney Mabui. We are medical students currently. I had an elective rotation in Nepal where I saw the challenges that come in with geographic barriers, while Whitney was exposed to automation in healthcare. We are asking for $45,000 to be able to do our pilot phase, where $26,000 each. We'll deploy 2 pilot kiosks. $26,000 goes to the capex for each kiosk, while the rest of the money will be used for regulatory, licenses, the operations, the monitoring, and materials, and HR, that will be 8% of this money. Chebet should not have had that stroke that morning. And with your help, no one else will. Thank you.
I believe we should be having questions, correct? Yes, so questions from the judges.
think this is a wonderful presentation. I think it deserves applause.
Sorry, just can you put my slides back, please? Thank you.
Are you okay?
Yes.
All right, good. The first question is in terms of you are going to charge $1 per interface.
Yes.
The question is, to what extent have you really undertaken the analysis that suggests that customers are willing to pay that much? Mm-hmm. That's the first question.
Okay. So, first of all, the reason we are asking for the money is for us to be able to do the pilot so that we can be able to prove the model that the customers are willing to pay $1. That's the conservative estimate, with $2 being the optimistic. For them to be able to just get their drugs from our machines rather than having to lose a full day of wages and using up to 20% of their monthly income on transport just to get to the hospital. Yes.
Okay, that's good. And I hope you have also considered in terms of the cost of operation.
Yes.
So that the $1 will really ensure that you're able to break even and maybe have some margin on top of that. Okay.
Yeah. Yes.
The other question revolves around your competition. Mm-hmm. I think some of the variables that you use there, I don't know whether you can clarify it for me. If you can go back to that, please. So you're using low, high, what does it mean?
Okay. So, for example, here at public clinics, most of them, especially in Kenya, from my experience, you might go to the hospital, you get your consultation done, and then you go to the public pharmacy within the same hospital, and you're told that there's no medication. So for us, we are solving by ensuring that this medication is always available once our patients sign up to it or from our data.
No, I think the starting point where we need to really work on the constructs here you're using. The last one, so that I can give space to the others, is how do you ensure that the patient or the client using the kiosk will get the actual medicine that is required?
Here I mentioned that we are going to authenticate using a biometric scanner or another option, especially for patients with difficult to read fingerprints. We can use an RFID, similar to your ATM card. So once you authenticate from our database, we are able to pull up the patient's history on the end of the healthcare provider, the one who's consulting, step 2. Yes. And this, after the patient is able to, the healthcare provider is able to interact with the patient, see that they are stable, he or she is the one who basically approves the release of this medication. So we ensure that there's no wrong medication to each patient, to the patients. Thank you.
Okay, thank you so much. Well done. My question is around if you were to be approached by a healthcare organization or the government for them to solve this, why would they choose you? What's unique about you to partner with them?
So we did some literature review, and models show that by improving medication adherence, governments are able to have a return on investment of 3.8 times. So for every $10 they invest with our product or our system, they're able to save $38 by reducing preventable hospitalizations. So that's why when we sign the regional government and national government service contracts, because we are passing significant savings to the healthcare system, we ask them, can you give us some of that and be able to make money, to make your money back as an investor? Yeah.
I have two questions. One's related to how is the system restocked? So is there a way that the people who are providing the medicines know that it's running low, and what's the turnaround time for restocking?
Okay.
And then the second question related to the stock, how do you ensure the security of the platform from bad actors, let's say?
So for restocking, this is where you want to do the pilot study. Currently, our models project that we are going to need $5,600 for operating expenses. This includes the money that is going to be used, just the logistics, not the buying the medication part, because that will be kind of funded using the grants and the grants and also the revenue that we are getting from the patients and the government. But this operating expense includes that. We're able to cover that with our models. And then for security purposes, I mentioned that our kiosks would be placed at existing community centers. So where we are placing them are places where already there's a large enough kind of settlement where we are able to employ a security guard or someone is already watching it. Or the other option would be going to a chief's camp. The chief's camps. I don't know if this is going to make sense to you, considering we are from different regions of the world, but yes. So chief's camps, they typically always have police in the camp. Yeah. Thank you. To the judges, thank you for the very wonderful questions. Yes.
At that point, congratulations for coming this far. I have two questions. Question number one, I'm sure you have assumptions.
Yes.
What is one key assumption which you have that if it was proved wrong, it would significantly affect this venture?
Yeah.
So what I'm asking is about the risk. Then the last question, what part of the customer journey are you not very certain about? And probably not just the customer journey, the journey of this venture. If you are supposed to test something more, what would that be? Thank you.
I'm going to start by answering the second question. Which part of the customer journey that I'm not sure that we want to test it out using our pilot would be, are our patients willing or basically willing to discuss their conditions with someone who's at a remote facility? This is a huge assumption that we are making, that we hope our patients will be willing to be able to discuss their condition. Yes, we might install privacy screens, but you know, we are humans. Some might require a bit more of the human touch. Yeah, that's one assumption. To the one, basically, failure point, if I might call it that.
Sorry for going back.
Yeah.
So if they are not, if that assumption is proved wrong, what would happen? And you probably don't have to answer, but you know.
I have a theoretical that a hypothesis, if you will, that if we are able to conduct public awareness campaigns, maybe through the release of videos, flyers, brochures that are able to show how the systems we've integrated it, and that our patients will be able to get proper care from our healthcare providers, then maybe it would encourage them to be more willing to discuss their conditions. To your first question, on what is the failure point in our model, is basically because health in Africa is really dependent on government funding, right? It really doesn't work without government funding. So the biggest risk to our model is, are governments willing basically to open their eyes to the opportunity in front of them saving money? Yeah. Are they willing to be able to save $38 by investing $10? Yes. If we are able to get the governments on board, then we are good to go. Yeah. Thank you.
Thank you. Now points. Please, another round of applause for him. Just a brief announcement for the judges. we also have 5 minutes for the Q&A portion. So just wanted to ask kindly if maybe before each Q&A starts, we might want to coordinate what the questions could look like so we stay within the time as well, so we don't eat into the time for the rest of the ventures. But thank you so much for the excellent questions, and I would also encourage the team supporting, if there are any questions the judges might have that they can't ask, maybe we find some way to get those to the ventures because they could be relevant for them beyond just the pitch stage as well to think about. Awesome. All right, next we're going to have Damwa Boost. Damwa Boost on stage. Domu Boost, sorry. Please encourage him a bit more, please.
Yes, amazing. Okay, you look amazing from here. One of the most mean thing I found is that you deny doing something that you are able of doing in preventing, and you let that thing eat us so that you cure it. Okay, in our hospital setup, a lot of women, our mothers, our sisters, our daughters die. They die because of a problem that we ourselves can prevent, low blood levels. With me, I have Emily. Every time I see Emily at MTRH, Moi Teaching and Referral Hospital, her at Mother and Baby, she reminds me of a dear one I lost. I lost this dear one because of low blood levels again. Damn. But I don't want to talk about it. But Emily is 20 years old. She is admitted at the hospital with low blood levels of 5.3 grams per deciliter. Emily needs to be transfused with 5 units of blood, in which this blood is limited in our hospital facilities, as you can see over there. Emily is struggling. She is fighting for her dear life and to restore her dignity, which is lost. Without these 5 units of blood, Emily will be just as the statistics says, 7 to 8 women who lose their lives daily in Kenya. So if Emily could have access to our project, Damu Boost. Damu is a Swahili name to mean blood. So if Emily will get access to our Damu Boost, she won't be here struggling to survive. She won't be here struggling for her dear life and her lost dignity. Damu Boost is a product crafted to elevate blood levels in women in reproductive age. That is menstruating ladies and ladies who are undergoing antenatal clinic. In the world, we have 1.9 billion women who are in reproductive age. 13.5 to 14.5 are in Kenya. And 32% of these women, that means 1 in every 3 ladies have low blood levels, ranging from 6 to 10 grams per deciliter. This is a real problem that need to be solved. And we are losing our women. Okay, we are aiming at bringing a solution. The solution is Damu Boost. We want to give a food supplement, a purely organic food supplement that will elevate blood levels in our women. This product will be retailing at $2. That is 240 Kenya shillings. For those families living below $1 a day, with just $2, you are able to get a supply that will run you for a whole full month. We have a serviceable obtainable market of 4.7 million. That is 32% of women who are in reproductive age, who will be our users for the whole month. Like every month, they will be coming to get our supply to cater for their daily iron intake. We hope to go into market by use of B2C, B2B, and B2G. I'm not working on this alone. I've partnered with Moi University Botanical Garden, who are my key suppliers of the ingredients I want, the organic ingredients I want. I'm partnering with the Cube Innovation Hub, which is helping with coming up with a system that will track the uses. How are the women's faring on? How are the HB faring on? How many are coming in new ones, and everything about it. Again, I'm partnering with MTRH, that is Moi Teaching and Referral Hospital Regional Blood Bank. It is giving us the data on the people coming to donate blood and how much blood is needed daily, monthly, or even annually. Yeah, I did my first piloting at Mother and Baby, where I met 141 users who, these are mothers who are in antenatal care unit, who used it, but due to, who used it, and they reported a great elevation of blood level by the time they were ready to deliver. Yes, here I am today because I do believe I can't do this alone. I'll be stuck there serving 141 women instead of serving this whole population that requires this intervention. That's why I'm asking you to help me get $6,000 that will help me scale to serve 5,000 plus users who really need to restore their dignity and save the women's life. This is my able team that worked with me through this innovation. And for that, I also need your feedback. Your feedback is so important in helping me save women's life, restore their dignity, and come up with the product that you yourselves will love. Thank you so much.
Thank you so much, and a great opportunity to learn more about your product. I have two questions. One, you mentioned that you are in partnership with Moy Botanical Garden to get the input you use for the product. I'm just wondering on your, let's say the product is well received in the market, so what will be your strategy for scaling to make sure that you have enough input to make the product? Because right now it's with a botanical garden in the university. So how will you scale up if you have the opportunity? And second question is more, can you tell us a bit more whether you did some research finding on how effective is the product?
Sure. Thank you. All right, let me answer the first question. My organic plants, which are my my raw materials, these are raw materials that are naturally available actually in the community, and as well we can grow them for sustainability. So the raw products are available in the market, but we don't want to highly depend on that because we won't be going into people's bushes to get the raw materials, but we can also aim at planting our own. So it is a plant that it is a kind of weed that can be planted in our botanical gardens, but being in an urban setup, we aim at getting what is available for us, that is the botanical garden around me in Moi University. Then we can partner with the owner of the fields, which will be getting the products from in the communities. Thank you. Then on the second question, I've just missed the question. Can you repeat?
The second question was whether you did some research to see actually if women use the product, the blood level is going up.
Sure. Thank you. So what triggered me to come up with this kind of innovation is that where I come from, in my community, you find that is western part of Kenya. Women, I grow up seeing women not being taken to hospital. And our older moms, our grandmas, could go get some weed, give it to them, and these women will just wait to that day of delivery, and they deliver at home, or they just go to a nearby facility to deliver. And I do believe, since I'm in a medical profession, I want to know what exactly is in this is in this plant that is making these women survive. That's why I'm asking for that to come and do, to come and do the testing. Under the legal activity, it will entail the testing to know the real component, the quantification of what's inside, to get the exact thing that those people in the society were doing. Thank you so much.
Thank you. How often do you check your users?
Yeah, my users, they've just been using the product for the last 2 months. And I can't say that I have real big data on their traction, but I entail on tracking them, let's say, on a monthly basis. Yeah, because iron is a component. Since a food supplement, there is a body-required intake of iron daily in our bodies. So I entail on doing the traction or on the tracking of the progress, the HB levels, perhaps monthly.
Oh,
Thank
okay.
you.
And is that enough time to see the results that it's working?
Yeah, basing from the science knowledge, they say red blood cells have a lifespan of 120 days. Those are 4 months, right? Yeah, by tracking monthly, at least you can see how is the progress. Not enough, but 3 months will be enough. But doing it monthly gives you the real progress. Thank you.
What's unique about the formulation compared to other supplements?
All right, thank you. What's unique about the formulation? In the market currently, I won't base my answering of that question to anything else, because what is there is curative drugs, the IFAS, iron and folic acid supplements. So having this in market, I won't want to compare it with others. So I'll say it's purely organic. It has additional nutrients, and we are using available products. Yes, thank you. Thank you so much. Oh, maybe before my minutes. Oh, I have a prototype here. Since I'm a blood donor, I might love to test some of the Down Boost. Thank you so much.
Thank you, Domo Boost. Thank you. Awesome. Before we proceed, another announcement for the entire room. So we're going to have a People's Choice Award. So I would encourage everyone in the room to please pay attention, even if you're not a judge. Figure out which your best pitches are. Towards the end, we'll have a Menti QR code that will pop up. It will allow you to vote for who you feel the best venture is. So there will be a prize going, I hope I didn't misspeak. A prize, right? Yes. There will be a prize going to the People's Choice Award winner. So please pay attention to the pitches as we proceed. Awesome. Next up, we're going to have Musan Health. Please give it up for Musan Health. I feel like the energy is dropping. Let's let her know we appreciate her like the others, please. Thank you. Is there a different presentation that we have access to? That's her poster presentation, not her PowerPoint slide. Sorry about that. Please just give us a few minutes to figure out the presentation slides. Proceed to the next venture while we sort out the slides for Musan Health. So up next we have Herb Ima. Herb Ima, please. Same energy, guys, same energy.
I'm so excited. And okay. Hello, everyone. I'm Imar Redwan, a founder and CEO of Harbima. And how many of you have think of eating a soil as a kid as actually a sign of a serious health problem? I'm telling you my childhood secret of eating a soil from the ground, quietly hiding from my mama. And back then I thought I just had a weird habit of eating soil, but it wasn't. It was pica and my body was screaming for iron. This is not just my story. It's the story of 24% of women of reproductive age and 56% of people's 56% of children in Ethiopia are anemic. Huge numbers, right? But the real tragedy is the only solution we have are imported synthetic pills that have severe GI irritation, constipation, and nausea that make the patient to quit using the supplement. Among 100 people, women ordered to buy the supplements, only 60% actually buy them, and among them only 11 to 18% actually take it as recommended. What about the others? They choose to live with exhaustion and debilitation, like me. And that's why I found Harbima. Together with a visionary and dedicated teams, after joining a pharmacy school and having a dream of creating the solution that I was wishing existed for me and millions of others like me. And we have developed Iron Plus highly available supplement powder based on Ethiopian botanical heritage, Reitef. Reitef is a super grain, gluten-free, naturally high in iron. And we also provide hibiscus-based relief tea to soothe menstrual cramp while restoring iron level. The scale of the problem is our opportunity. More than 40 million Ethiopians are facing anemia. We are focusing on 2 million people, women which are digitally active and seeking for better wellness solution. And among them, we plan to get 5,000 early adopters within the first year of our launch. Our primary driver is directed to customer sales through our website, social medias like TikTok and Instagram. And we also leverage B2B partnership with local pharmacies to patients which prefer retail purchase. Now, currently, we have produced our first batch prototype, and we got our business plan ready. And we are on the process of starting a clinical trial to prove that our Harbima product actually prevents anemia and actually works. And for that, we use a clinical trial which lasts for 5 months. And local material and packaging partners are also secured, and we got a DTC website integrated, and I put the QR code here. So our competitors are the synthetic pills, which have severe GI distress, nausea and constipation, as I said before. So we are giving affordable, natural, culturally integrated that fits seamlessly with her daily routine. I'm Imar Redwan, as I said before. I'm a dual major of pharmacy and marketing, and I'm doing the clinical formulation and brand strategy. And joined with my CTO, which built our digital platform, and our regulatory and lab lead, Bethlehem. And we have an advisor, very kind person, and he is a GMP, good manufacturing practice, and regulatory expert. And he is guiding us with his knowledge and connections. Today we are asking $5,000 to bring Harbima to the next stage. And finally, the woman who started Harbima with a great vision, I'm asking you to join our journey to give the Ethiopian women the care they truly deserve. Thank you.
Thank you. Thank you very much.
Thank you.
For your presentation. And good to know that soon you will be going for clinical trial.
Yes.
Yeah. You have spoken to customers that have used your product that you are testing already.
I haven't given my product for customer yet because I have to prove that my product is safe and has a quality and effective before giving the product to the customers. So I have to do a very intensive clinical trial to prove that actually this product actually works before giving my product to the customer, because I know there are a lot of scams out there which brings some products and will get bankrupt within 3 to 4 months, right? So I have to get approved before providing those products to the customers.
What is the value proposition of your products? What would make customers prefer your product and not the alternative?
Okay, because as I said before, the solution we are using are pills, which have side effects. So as the numbers indicate, those people are not liking taking them because it is hard to swallow, has severe GI irritation, and most people just, including me, just stop taking it. So we produce, the powder is used routinely. You can mix it with your smoothies, your juices, your water, and take it. And also, it's a sustainable product because Ethiopia, for those of you who don't know, Ethiopia produces more than 90% of teff out there. And more than 20% of our agricultural land is covered with teff. And we produce around 5.2 million metric ton of red teff per year. So it is sustainable. I can get the raw materials inside my country. It is local, culturally integrated because most people are using it.
Okay, thank you so much. I have a follow-up question on that. So how much does it cost to produce a unit?
To produce, we are selling it actually for $1.5.
Okay.
For this sachet, and we have 40% profit margin.
Okay. Where is the production taking place?
For the prototype?
Yes.
On our university lab, pharmacy lab. I'm a pharmacy student, and I'm using the pharmaceutical lab inside my school.
Okay. Is that where it will be even when you're done with the prototyping?
I am planning to build my own lab.
Oh, okay.
After the clinical trial ended. Thank you.
Yeah. Thank you, Imam, for sharing your idea, innovative idea. I'm just wondering whether on your sales strategy, you talked about website.
Yes.
Retailer, and all this is happening in Addis. I'm wondering in Ethiopia, sorry. I'm wondering in remote area of Ethiopia where connectivity is not, it can be an issue. What will be your strategy? Because probably the one who cannot afford the iron pill are more in those areas, remote area, and they will benefit from this product.
So we are using our direct-to-sales website for urban women, which are digitally active. And we use our B2B platform, which is partnering with local pharmacists to provide for the girls out there in the rural areas which can't access the internet or any digital platform. Anything else?
Thank you. Awesome. Thank you so much, Herb Ima. Now we're going to take a step back to welcome Musan Health to the stage. Musan Health.
In 2022, my body started doing something I didn't ask for. Unexpected spasms without any warning. I went to clinics, I saw specialists, and I got tested. Today, 2026, 4 years later, I'm still not diagnosed. I know what it feels like to wait. I know what it feels like to live in the silence between a question and an answer. And I know that I am not alone. In Africa, diagnosis is not a moment, it's a journey. Patients wait weeks, even months, to get their diagnosis. And 50% of them are treated without any confirmed diagnosis. And for 4 pathologists available for millions of people across Africa, in most of the health facilities, there is 0 pathologists available to read a slide locally. And that consumes up to 5% of continental GDP and brings antimicrobial resistance. That's why we built Mosan Health, AI diagnostic at the point of care. Mosan is a portable, affordable, digital offline first microscope, and the workflow is intentionally simple. The clinician prepares the sample and places it in, under the microscope. Our camera takes high-resolution images, feeds it into the AI, and gives out a diagnostic. Mosan does not replace the clinicians. It stands beside them, extending their reach, sharpening their eye, and giving back their most valuable resource, time. This is not a single-purpose device. It's a platform. One platform that is today targeting cervical cancer will target tomorrow anemia, other types of cancers, tuberculosis. The market is huge. Our total addressable market stands 185,000 clinics across Africa, and in Senegal alone, it reaches around 4,000 health centers. But we earned the right to scale by starting small with 15 units deployed within 2 years. Our business strategy stands on 3 pillars. First, we have direct sale of the prototype at $2,500. Second, we have diagnosis as a service, which would be a monthly subscription to the AI diagnosis with cervical screening as a baseline and add-ons later on. And we have data licensing with strict ethical guidelines and anonymized epidemiological data for public health. Our roadmap goes from R&D to deployment within 24 months, from prototype refinement to clinical validation, regulatory readiness, and deploying in our partner labs. $500,000 in capital. Our Mosan Health aligns with Senegal digital and health sovereignty, and also with the World Health Organization 90-70-90 strategy, aligning with Sustainable Development Goals 3, 9, and 10. And with $1 invested, we have $10 social ROI back, and we optimize diagnosis time from weeks to 15 minutes. With 91% accuracy, we aim to reach 10,000 people within 2 years. Our team is composed of 3 engineers at the Dakar American University of Science and Technology. We have Khadija Tuja, who is leading the mechanical computation and manufacturing, Aja Madi Toure leading the AI and software, and myself, data and IoT, and we have a clinical advisor, Dr. Gay, who is a pathologist at Hôpital Militaire de Ouakam. I didn't get my answer yet, still waiting for it. Mosan won't diagnose me because my condition is in another field. But Mosan is here to answer millions of people that where the answer lies in things we can detect. In diagnosis, time is life. Let us give it back. Thank you.
Thank you. Thank you so much for your presentation and the passion that you put to your presentation. For clarity, you are building the hardware.
Yes.
Are you?
Yeah.
All right, not a question, but just some thought. Do you need to do that? Who is in the team that has got the set of skills that would help you do this? Would it be better to consider partnering with some firm outside there who is already doing this? Just a thought. My question is, what support would you need right now? And in the next 6 months, what milestones are you looking forward to achieving?
When you say support, you mean financial support?
It could be one of those supports or otherwise.
Okay, thank you for your question. Right now, we will need, we have a collaborator, which is IRSF, a lab in Senegal, in Dakar. We are partnering with them for clinical validations and data. We will need also to have other partners than them. That's the support we need. And in terms of money, we would need grants to actually make the prototype. Within the 6 months, that's what we're going to do. Prototyping, validating the prototype, making enough units to actually go and do the clinical tests inside the laboratories, like the partner laboratories. And for the first part, I am right now handling the IoT and the hardware, but I am not the only one who can do that. All of us can, because 2 of us are computer science engineers and the other one is a mechanical engineer. So all of us work in the design, the IoT. I handle it more because we dispatch the work, but all of us have the ability to actually do it.
Thanks for that. So let's assume you get your $500,000 ask. It's not going to come from me, just to let you know that. But you get to deployment and production. What's your customer acquisition strategy? Your customer acquisition strategy. How are you going to get users for the product once you start making it?
Okay. So the users are the laboratories, clinics, hospitals. So we are not directly working with patients. Those institutions, NGOs or ministries can buy it. And also the labs, we are selling to the labs. They will buy it and use it. They are the one who will be interacting with the patients and getting the data. Yeah.
And so how are you going to position this to acquire customers, I guess? Like, what's their incentive if they have, say, microscopes already? Like, do you have a plan to incentivize them to adopt your technology?
Yeah, like by talking to laboratories, we go directly to them, talk to them about the product we have. And right now we are a little bit known since we have been pitching the project to competitions and like across events. They know a little bit about the project and they are very interested in getting it done, actually using it, testing it. A lot of hospitals are actually and labs are contacting us to test our product.
Before my time ends, why cervical cancer to start with? Quick one.
Yeah. We actually started first with malaria. We tested for malaria, we saw like the density and so, but malaria is urgent. Is like Africa is the most killing disease. Like everybody is affected by malaria, but cervical cancer is more critical in a way where the waiting time there is just enormous. People wait for months to get their results. So, and it's a leading killing disease in like for women. So that's why we actually chose cervical cancer.
I'm going to get slapped on the hand for this again, but one more question. How do you manage the data storage and that process?
Yeah, the software is connected to a server, an outside server, and when every picture that is captured and that gets a diagnosis is sent directly to the server, that's where we store the data. Yeah. Thank you very much.
I would just like to say, Dave, you owe me $5.
Checks in the mail.
Awesome. All right. Next up, we'll be having CardioSense.
Thank you. 80% of cardiovascular-related deaths are preventable. My name is Dr. Patricia Wanjiro, a co-founder of CardioSense, and we want to make this 80% a reality in Africa. This dream was born during my 5th year in medical school. I was placed at a primary rural healthcare facility in Igagania in Kenya. And this is the kind of picture we would see when we were in clinic. A 48-year-old woman walks in. She has been experiencing chest pain and tightness for over months without any kind of assessment. Why is this? Because there's no specialist at the clinic to review her, but today the symptoms are too much. By the time she's presenting at the clinic, the critical opportunity for intervention has been missed. And the clinician sitting in that clinic is a primary healthcare worker who does not have the tools that would properly assess this patient. And this to me was not a clinical failure on the clinician side, but rather a systemic failure. Cardiovascular disease is killing Africans slowly before even they get a diagnosis. In sub-Saharan Africa, it has been shown that we have the highest growing rates of cardiovascular disease than anywhere else in the world, with one cardiologist seeing millions of patients, and globally, every single minute, 37 people lose their lives to a cardiovascular-related death. 3/4 of these people will be in low and middle-income countries, for example, in sub-Saharan Africa. Despite all this, 80% of these deaths can be prevented. And this is where CardioSense AI comes in. We are aiming to build an offline-capable, portable cardiovascular risk screening system, which combines a lightweight cardiovascular monitoring device with an on-device AI model, which means that it should be able to work offline. The cardiac monitoring signals are fused with clinical risk factors for the patients, and it will deliver a risk scoring under 60 seconds for the primary healthcare clinician to act on. How are we different from what is currently in the market? We will not need any internet to run this device. No specialist is required because the AI model can give easy, plain language recommendations to the primary healthcare clinician. We aim to build it on African data, and it is designed specifically for primary healthcare and will integrate seamlessly with already existing health information systems. We are not just building a concept. CardioSense AI has shown a promising trajectory. We have trained our AI model on existing patient data and externally validated it, and it showed a 92% accuracy in predicting heart attack risk. We also have partnered with the Alliance for Medical Research in Africa, who provided us with African cardiovascular monitoring data, which has been used to build our model. And in the data that was provided, we were able to flag 2 priority referrals who are now under the review of a cardiologist. we are aiming to build a self-reinforcing network that will grow more valuable with every new clinic partner. We aim to do this in 2 phases. In the first phase, we will go through a mutual value exchange. We approach clinics with our device at 0 upfront cost, offer them something that can give them AI risk scoring in under 60 seconds with no internet provided, very easy for the clinician to use. And in exchange, they give us some clinical risk factors for their patients. All this data will be anonymized on the CardioSense AI's interface, so we'll not have any access to patient data, and it will be protected under Kenya's Data Protection Act in 2019. This is what the clinic will gain by working with CardioSense, a diagnostic capability like they have never had before. We are going to integrate directly into existing health information systems. In Kenya, over 100 community healthcare workers are already digitized. And then after we have validated our AI model, we plan now to sell it to private clinics and hospitals, NGOs that want to do community screening effectively, and gradually scale up to the Ministry of Health, which will offer a highly subsidized access to our tool. We have already done the hard part, and so at this stage, we require some hardware funding to be able to fully build our prototype, and then also conduct a clinical validation study with clinic partners and connect with people who want to work with us. Every minute will matter when it comes to a cardiovascular disease death, and yet millions lack screening, timely screening. And us at CardioSense AI believe that your geographical location should not determine whether or not you receive the care of level that you deserve. Thank you. These are my partners and my teammates.
Thank you, Patricia. I love the clarity of understanding of the problem. Your solution seems to target multiple clientele. So I'm wondering if you could only serve one segment in the market. So I'm talking about targeting. What would that segment be? And what would be the why of serving that segment?
All right, thank you so much for your question. And to answer you, I think for CardioSense AI, our main aim is to have this tool be highly subsidized for our rural communities. And so the main and the end goal for us is to be able to work with ministries of health who will be able to provide adequate funding for their primary healthcare level facilities to be able to access our product. So that is our end goal in terms of who we are trying to target, even as we go through the different development stages with different partners.
Yeah, I think it's a wonderful presentation. I will just be quick in terms of my question. Your work will thrive extensively on AI data. And the partners that you are envisaging, to what extent would they be willing to share the data with you? And why? And why should they do that?
Thank you for your question. I believe that the clinics that we want to approach to assist us with the data to train our AI model on African cardiovascular monitoring data will benefit greatly from our integration from our device, because we are giving them a diagnostic capability that they have never had before. They're able to see more patients in less time and have better outcomes as an institution. And so we'll be able to provide them with a clear clinical decision tool. It's not to exist on its own in separation, but to help the primary health care clinician give better care. So this will lead to better outcomes for both the facility and the patients that they serve.
Can you further define what do you mean by African cardiovascular data? Like, what's the sample specifically? What population is it from? And then what's your plan to train the AI model further to represent, I guess, a broader and more specific demographics for particular communities? Because there could be variance country to country on what the data might say. And so I think that's really important for the efficacy of it going forward. So what's your plan for getting, I guess, more specific data for that's representative of particular populations as you grow?
All right, thank you for that. I think that is where we are leveraging our networks. For example, we are partnering with the Alliance for Medical Research in Africa, which has access to a lot more data than what we can have as CardioSense. But at the same time, we are planning to start small, for example, starting in my country, Kenya, and be able to scale that up to a regional reach where we are able to collect more data from other countries other than where we will conduct our pilot validation study.
Thank you. Are you planning to track how the model works across different genders, population, and age group, or are you doing that already?
Yes, so part of the data that we have worked with in training the AI model included such data. So some of this data are clinical risk factors like the age, the gender. So all of that has been used to train our AI model. At the same time, we are doing all this while ensuring that there is patient consent, and we anonymize this data so that it does not go compromise patient confidentiality. We will work with institutional board approval as well, so that as much as we are collecting data on the clinical risk factors, we are not putting the patient confidentiality at risk. So yes, we are collecting that data.
For some thought, you are putting ask for 50 to 80 thousand USD.
Yes.
If you did not have external funding, how would this venture still be sustained? That question is looking at what is the smallest version of rolling out your solution without losing value.
Okay.
Not for answering, but just for thinking through.
Thank you. Thank you for the comment.
Awesome, awesome. Thank you so much. An audience, please clap for yourselves. You've been great, receptive, very receptive of the presentation, so please. We have one more pitch to go before we break for lunch, so I'll please encourage everyone to stay attentive, give your full focus on this last one. We have one more to go for the idea stage, and try to minimize the side conversations as it is a bit distracting to the judges who are trying to pay attention to the pitches. So let's give our full focus on the final presentation on the screen as we're about to proceed.
A girl's future should not be determined by her period. Today, somewhere in Ghana, a girl is missing school, not because she is sick, but because she is in her period. Not because she is sick, but because she is in her period. But this girl has dreams. She has a future she is working towards. But every month, because she lacks something basic as sanitary pads, she misses school. But the problem is bigger than what we think. Over 500 million women globally lack access to basic menstrual products. And in sub-Saharan Africa, many girls rely on unsafe alternatives. They use rags, old cloths, and tissue papers. And this leads to health risks like urinary tract infections, bacterial infections, and also reproductive health complications. But period poverty is not just a hygiene problem in Ghana. It is Ghana's most expensive silence. Why? Because sanitary pads cost around $2 to $3 because these products are largely imported with 32.5% tax on them and making them the prices high and unstable. And this mostly affects our rural communities. Our solution is simple but powerful. Our solution is simple but powerful. We aim to use local waste materials to produce biodegradable pads, corn husks from farmers, cotton from factories, and unused papers from clinics and schools, because this would significantly reduce production costs and also provide affordable, sustainable alternatives for our rural communities. Yes, we already have commercial brands, but these products are expensive. They are imported. And organizations that donate sanitary pads runs out before the next month. Organizations that also focus on reusable only cannot serve all girls, especially those without consistent access to clean water. To our knowledge, there is no social enterprise in the Upper West region of Ghana that combines these four models: biodegradable sanitary pads production, reusable pads training, and also a free digital app, all these under one self-sustaining model. But we are not just sharing our solution to you. With $2,500, with zero formal investment, we have been able to get sanitary pads from the market. 1,000 sanitary pads were donated to girls in deprived communities, and we have been able to train over 700 girls to produce reusable sanitary pads, and also support all with a free digital app that helps girls to track their cycle, and also have educational content about menstrual health and reproductive health. And then this app also has a question and answer feature that generates stigma-free answers to questions regarding reproductive health and then menstrual health. The market is massive, it's significant. Our total addressable market is $4.3 billion across West Africa. And then our serviceable available market is $22 million across Ghana. Our business model is designed to be both sustainable and impactful. We aim to generate revenue from product sales, partnership and grants, workshops, education, and then every 3 packs of pads sold, 1 pack will be given to a girl who cannot afford. Our team is built with 4 different backgrounds. I'm the founder of the Menstrual Empowerment Initiative, and then my field is entrepreneurial leadership, and then my co-founder is Faustina, a student at Ashesi University, and she is a computer science student. And then another team member is Victoria. She is a student at the University of Development Study, Doctor of Pharmacy student. And then we have Favor, a student at KUST, and she is also a computer science student. This team grew up near the problem we are trying to solve. We watch girls lose opportunities, lose their future because they cannot afford sanitary pads. And therefore, we are raising 4,000 to scale production. 1,500 for production, 1,000 for a hub setup, 1,000 for operations, and then 500 for marketing.
Thank you, thank you, thank you.
Okay, that is wonderful. I think we're seeking some, is it a social enterprise or a profitable one? I'm not too sure. We come to that. My key question here is, you're doing something significant, really address the poverty, the period poverty. But to what extent are your customers willing to adopt it? What kind of research have you done about that?
Okay, we did a survey research in the Upper West region of Ghana. People are looking forward for like affordability and then the absorbance of the part. That is what they are really focusing on and how it impacts their life, not having like health complications. Thank you.
Yeah, and I didn't see anything about your pricing and how it compares with the imported ones.
Okay, so like the imported ones, like I said, it costs like $2 to $3, but ours will be like 0.09 distant dollars. So in Ghana cedis, that will be like 6 to 8 Ghana cedis.
That's against 15
yes.
or 30. And have you also explored in terms of the cost of production as against your set price?
Yes, please.
How much is it going to cost you to produce?
Okay, for the corn husks, we have already like spoke to farmers, telling farmers that, oh, this thing that you are throwing away can actually help your girl who cannot afford a sanitary pad. So they are willing to give us free for production.
All right, just not to torture you too much. Have you considered that once you start taking these raw materials for free and they begin to realize that you are benefiting from that, they may consider putting a price on it? And what would you do if that happens?
Okay, so we will start with a low price, like I said, 6 to 8 Ghana cedis. So since we are getting it free, we will start with 6 Ghana cedis. But when they ask us to like give them something to get the waste materials, that is when we will now like proceed to like 8 Ghana cedis. But we are also looking for affordability because girls are suffering because the prices are high.
Thank you. Thank you for sharing once more. A congratulations being here. I'm trying to understand. So your strategy, you are training girls to make their own pad, which is great. At the same time, you are making a business out of it. Can you explain a bit what is the business model behind that? And tell us a bit more about your team expertise. From what I heard, there were more computer science and so on. I want to understand how did you get to the solution of using corn? Why corn? And how effective corn is in terms of absorption, comparing to other crop. Yeah. Thank you.
Okay, so why we focus more on the corn is because in the Upper West region of Ghana, most of the farmers, we have like over 160,000 farmers that farm on this thing, maize every year. And then that's why we focus mainly on the corn, because corn can be processed into a powdery form that can be like the absorbent material for the sanitary pads. And then for the team, Victoria, who is our operations lead and the doctor of pharmacy, she will be the one to be in charge of our process, like partnering with FDA, getting approval of like our production to test our products, whether it's actually worth it before we send it to the market. And also her mom is also willing to support us because she is a laboratory scientist, and she also has like a private clinic where they like, it's a laboratory clinic, private clinic, yeah.
So my first question was on the, when you are training the girl to make their own pad and doing distribution in the community at the same time you want to sell it in the same community. So what will be the motivation for a girl to buy it if they know how to make it?
Okay, so our previous distribution on what we did, we started as a social impact. That is why we have been able to like distribute a lot of sanitary pads to girls. But our business model is also like focusing on giving to those that cannot afford. And then the price range to also help girls to be able to like afford the sanitary pads, because they are also looking forward for like the affordability, not just the free pad distribution. Because as NGOs that donate censorship pads to girls for free, it's not like they have it all year. You still want to buy your own products. So this is what we now bring in, our solution. That is when our solution now comes in for like affordability for every girl to be able to have access and then buy the products.
I owe OSAS another $5 for this question. So if you get the $4,000 to scale production, how much is your production capacity going to increase? What's it currently, and what will that take you to?
40%.
40%. So, like, is there a number? Like, how many pads will you produce for $4,000?
Okay, for like 1 to 2 years, we want to like serve over 30,000 girls in the Upper West region of Ghana specifically. And then like expanding to other places, we aim to like serve 150,000 girls and young women across the whole Ghana. So generating revenue will increase over like 133,000 Ghana cedis.
Apologies, I'm over time, but how will you make sure that the donated products reach the intended beneficiaries?
Okay, so our partnership NGO, when we started our project as a social impact project, we partnered with Comfort in the Upper West region of Ghana. And Comfort also focused more on girls' education. So they were the people that connect us to communities that are really struggling with when it comes to like period poverty. So that is when we will have girls that are really struggling who cannot actually afford the pad. Welcome.
Thank you, thank you. All right, awesome. We've come to the end of the idea stage pitches. Please give everyone a round of applause. So next, we have lunch coming up. But before we get into lunch, I think we had a very exciting day yesterday. So the team would like to show you a bit of what happened yesterday for those who might have not gotten the full picture. So please pay attention to the video on the screen on the data recap. Thank you.
Welcome to day 2 of the Health Innovation Festival 2026. Our focus is shifting from ideas and we are moving closer to impact.
Together, we have an opportunity not only to reimagine healthcare in Africa, but to help shape a future where young Africans are leading innovation, driving economic growth, and building stronger, healthier, and more resilient communities across Africa.
People invest when they can understand and when they can believe.
What we do, we provide home care for such clients. We partner with the hospitals. So rather than the hospitals discharging the patients home, they discharge the patients to us as Benevita Home Care.
And this is where Eco Diaper comes in. Eco Diaper is a sustainable solution that produces biodegradable baby and adult diapers which use banana pseudostems or plantain pseudostems.
The mentorship I had, the kind of skill set I built, the kind of intellect, or let me say the business acumen I had from there was very, very, very much important. By the special grace of God, I got there, I secured some seed funding, and now we can boldly talk about a product, not an idea.
And one thing that helped me was a very good supportive system. Because if you are doing a business on your own, when challenges come, you forget the main reason why you started.
Boldness can create some magic for you. And to get that funding, you have to be persuasive, right? You need to know what gets people to put their hand in their pockets and say, take this amount of money and run with it, right?
Lovely, lovely, lovely stuff. Okay, it's time for lunch, guys. So make sure you grab a ticket from someone from the Ashesi team or the planning team before you head over to the cafeteria or the lunch area. And yeah, we'll be back here shortly after lunch to proceed with the early stage final pitches.